Thank you so much, Fish, and thank you to the committee for the invitation. I will talk fast because I have way too many slides. But it's also an area that I think too often is assumed to be understood and then gets lost in the translation. So I'm going to try to move this. Okay. So the four elements I'll be talking to you about are what are the challenges in using this concept? What are the definitions of culture that people are using to even identify where the source of values or outcomes might be, then how to apply it and what might be the policy implications. So the first thing on challenges is how has culture been viewed in health? And very often, it's been used often. But the confusion is how it's used and what is actually being measured. Usually it's only by racial ethnic categories and glossed as uniform among the diverse groups. David Lacey, an anthropologist, wrote that when discussing multiculturalism, the concept is used, quote, to provide some exotic spices to season the otherwise standard prescriptions for children's schooling and welfare, rather than integrating the multiple ways in which child development is truly shaped by culture. So this will be what I'll try to focus on in this presentation. Also, just to build on the two panels we had on actual parents, is that if the problems, Dr. Gil Friedel, who used to be in Kentucky and also from Harvard, said that if the problems are in the community, the solutions are in the community. And as a nurse and anthropologist and public health professional, what I've found is how rarely the community voice is actually heard. And so I applaud the committee for having the representatives here, because without those voices, we're literally just spinning wheels, I think. Oops. Okay. Oh. Why is it going backwards both ways? An example is, what is the outcome we're actually envisioning? What is good in the outcomes that we're trying to promote? In Japanese and Chinese, the character in red is the one that means person, individual person. But when children are taught to write the character, they put two heads on it, because inherent and fundamental in the concept of individual person is interdependence. Versus the English version of writing an I for person is, and the whole psychology of development, childhood development, is individuation, autonomy, defining your boundaries, which doesn't occur, I use this for Japanese, but it doesn't occur, as far as I can tell, after these 45 years in the field, of any community of color. Goes more towards the top left than the right. And most of our interventions are geared to the right. In a study that I did with end-stage disease cancer between Japanese Americans and Anglo-Americans, when I had them fill out the self-esteem, Rosenberg self-esteem scale, which I know is very old, but it's very short as well, and so I wanted to just test whether the cross-cultural applicability was there, and they all scored very high. I was doing an ethnographic study. They had to bear my visits at least monthly for as long as they lived, and my dissertation time as well, for at least a year. And so they had to be fairly hardy folks to allow me into their lives that often and for that length of time. But it puzzled me, because growing up Japanese American, that would not have been the score I would have expected from the Japanese Americans. When I asked them, what is a good person? These are the characteristics they gave me, and what stunned me was good self-esteem for Japanese Americans. I thought, that is not how I was raised, just the opposite. You never think about yourself. You know, it's always the other. And so when I asked them, what does good self-esteem mean to you? Humble and no ego. I can guarantee you that is not what the Rosenberg scale is trying to measure. Right? So what happens then when we're applying these categories to communities that we don't know enough about to be able to evaluate the outcomes of studies? When I asked them to then grade themselves according to their own criteria, this was a distribution, and just look at the EF, the reddish, the purple, I'm sorry, the Japanese females. I got this strong left skew, and I go, okay, that fits what I know about the Japanese American community. These are children, Hmong children in Sapa, Vietnam. Their identity is so foreign. They're a pre-literate society who came here to the United States as refugees because they were targeted for extermination in Laos, having participated with the CIA during the Vietnam War. And despite there being, a really rural community, I now work with Hmong colleagues who are lawyers, doctors, Indian chiefs in that sense, who are real leaders, but what have their parents done when they came with so little? We also have mixed race. How do you categorize those individuals? Which culture do you focus on? Or what is the blending that occurs across time? This is a Conrad cartoon that the caption is, "Two boys on a stoop. What do you want to be if you grow up?" And this is the reality in so many of our low-income communities. How do you manage amidst chaos? And Clarissa, I thank you for your description, because this is what, in working with these communities, I've learned is there's so much noise because you've got so many things simultaneously pulling you on on a primary survival level, that how do you attend to anything else beyond that? And usually you can't, and your health suffered for that. Sorry, this is counterintuitive to me. So if culture is fundamental to human existence, there's no such thing as human nature independent from culture. It's a way of life and thought that we construct, negotiate, institutionalize, and finally end up calling reality. But despite its central role, no other variable used in health research, and I would say psychology and development as well, is so poorly defined and untested as culture. So as Dr. Viswanthan indicated, this is a report that a group of colleagues and I came up with to define culture. There are hundreds of definitions. We're just asking whoever's using it to define it first and then explain how they're measuring it, because right now we have no clue. And comparing studies of diverse populations, we don't know whether the measures are comparable or even the same across groups. So the first thing would be actually to define it. And then we do go through steps on how to do that, and cultural equivalence of measures is a critical piece on that. And that we have very little, at least in the health literature, to indicate the equivalence. So first, in defining culture, is to differentiate what it is between what it does, and how culture of research assumes explicitly or implicitly universality of norms and of thought and behavior, but it's yet to be demonstrated. So we all have gone through the research process. We all know how to do that, and the committee knows how to do it well. What hasn't been included in this is the cultural context of health research. How does it differ from group to group? What are the criteria? We don't know that. We don't know if the concepts are comparable. We don't know whether they have the same relationships. What is the role of the parent versus the grandparent versus a fictive aunt or grandmother or mother in different populations? So I think one of the major points I want to for this presentation is this study done by Henrik and colleagues in 2010 talking about weird people that's white, educated, industrialized, rich, and democratic. He said they make up 14% of the world's population and yet assume that their findings are universal. When it has been tested, it's shown not to hold. And yet we continue doing the same thing with the same framework. So I'm urging you to consider alternate realities. And he said, and they say, especially in child development, because when they do studies on developmental anythings, they ask for volunteers, and who else can respond to them but weird, middle class, upper middle class women who can afford to bring their children to the universities to be tested. And how much is actually done in the communities? What ethnographies have informed the kind of science that we do? Many of my students who come from very diverse backgrounds come to the school, to the universities. They've been successful to get to the universities to respond to this problem. This is how the dinosaur lived, goes extinct, gets excavated by scientists and reconstructed in their concept of how this person may have, this creature may have lived back in the day. And the students will tell me, like this one who was doing a study on domestic abuse amongst Latinas. She is Latina. And she said she hadn't heard in all her review of the literature the Latina voice. It was always done by others who are not and who have not experienced this. And what are the reasons for women staying in those relationships? So this is a constant theme that I hear from students of color looking at the science that exists. So we lack a well-grounded concept of culture, the measures that accurately operationalize the aspects that most affect the health issue of focus, and studies that test the hypothesis of culture's impact on health, excuse me, on health outcomes. Rena Pasick and colleagues conducted the first study that I know of, and one of the few, if not only, that looked at the 5 major concepts in health behavior. These are the 5: perceived benefit, perceived susceptibility, self-efficacy, intention, and subjective norms. And what they found was that none of them hold true in the 2 groups, Latinas and Filipinas, in looking at mammography and cervical cancer screening. Intention is one of the keystone pieces in health behavior choices. And she found that that is one of the key ones that did not hold, because there were other issues that were more primary. And so with our theoretical structures at this point in time and how we're applying them in child development, that needs to really be critically evaluated to demonstrate whether or not it's making a difference. My area of research is health disparities. This is just eating 5 fruits and vegetables a day and encouraging children in schools and all the school lunch programs, et cetera. And what they found over this period of time is that the millions and millions of dollars spent on this campaign have not made 1 iota of difference. Leonard Symes at Berkeley wrote, in 40 years of funding health disparities research, we have not made 1 iota of difference. So what's happening? And critically, because of the demographic changes in this country, where we will be, California was the first state to have no ethnic majority. This will be the face of the country by 2042. If we haven't gotten it right at this point in time, it is only going to get worse. And so the 3 goals of the framework are to define culture, to provide a roadmap to guide both the researchers, reviewers, and funders in how to apply it, and to illuminate the monocultural ethnocentric basis of health behavior science. And I have a minute, and I'm gonna have to squeeze more into that, obviously. But the unreflective use of theories has really been problematic, especially in communities of color. The monocultural norms of outcomes really is an area that needs further investigation to see if those are appropriate. But cultures are not static, they're very dynamic. We know with every immigrant community or geographic move that people make, they're going to have to change, and they do. The purpose of culture is to adapt and survive. And so I just wanted to indicate what this variation means in how we eat, how we raise our children, how we see ourselves, what is our role of parenting. And the purpose of culture is to assure survival and well-being and provide the meaning of and for life. So that fundamental purpose requires us to then question how we design interventions, how we design outcomes of programs, and then what are the evaluation tools that are used. And is it socially, morally, and legally integrated into the structure of a society's institutions? I'm going to skip forward just a little bit and just emphasize here that it is very difficult to look at only one level. We know that the entire system of any ecologic niche of a people that lives in that area will be determined by their external factors. This picture, when I found it, I was just devastated by it. But the purpose of it is to emphasize the fact that it's not by choice that parents cannot provide for their children. It's the external forces, be it war, be it famine, be it climate change. And this happens in every group. We're having the opposite effect internationally on obesity. Is this because parents want their children to be overweight? This is the first generation of children that will likely not outlive their parents. It's a frightening point, but do the parents purposely do this? What are the other external factors that are driving their behavior? A friend of mine who does nutrition in school said that the top, which I don't find very appetizing, but is the school lunch versus what the kids, they literally open the kids' lunches, and this is what they're getting. But I talked to a Hmong mother who didn't speak any English, her kids watch TV, this is what's advertised. And she said she wants her kids to be good Americans. So if this is what they're advertising, they're not going to be advertising things that are bad for us. So that's what she gets for her kids for lunch. So she's doing that out of what she thinks is a positive without understanding what the negatives can be. And which family are we talking about? For many of our populations, the biologic is only one. There's also ritual and fictive kin that play a strong role in raising that child. So which goals are we using for good parenting? What are our measures? And for the United States, independence, individualism, self-esteem, self-reliance, and happiness, they're written into our Constitution. This is what our country is based upon, and our institutions as well. Whereas what I found was that everyone else, it started out with Japanese Americans, and this is actually a list from Canada of their country's values, of interdependence, community group welfare, group consensus, and the belief that, this is my addition though, for many cultures, Buddhism, the basic tenet of Buddhism is all life is suffering, and then you go from there, okay? Which is very different than a happiness goal. I won't go through these. Looking at outcomes, this was a study we did on the midlife transition for women. And the central story was the same. It's a major change at around 50, with physical, emotional, and social. The shifts in outlook on life due to these role changes, less enmeshment in family responsibilities, and an ability now to focus on yourself, and the lifestyle changes and views of health. That was common amongst all the groups. These were done in 6 different ethnic groups across the country. But for the European Americans, women became invisible at that age. You no longer have a valued role in our society, where for all the groups of color, it was a good point in life. Women look forward to menopause because it was a good time for them. You divest yourself of all the other responsibilities of being a woman, and you can actually now be a person, which was really liberating. And that collectivism and a good, kind person Both talked about invisibility, but the invisibility for the Euro-American women was no longer being on magazine covers, leading roles in movies, somebody stopping on the freeway to help you when you want your tire changed. But for the Japanese women, they said invisible was good because then I could be like sunshine and bring help to everyone else. So same word, which has an implication for our scales, and cultural equivalency. So just a couple of slides on policy implications is to promote the universal truths or optimal outcomes of parenting. And what are the universal truths in parenting? What I've come up with as an anthropologist anthropologists told me, do not use bullets, and that's what I came up with. Was survival and security. That's basic. That was that young starving child. If you can't provide that for your kids, you can't look any further beyond that. Integrity, not self-esteem, but integrity, and how is that defined in all the other cultures? Being an integral part of a social network. And this is very often how our programs are designed, or to the individual child versus the whole network. And I think the programs that were described here were all social, getting you reconnected, getting that sense of community back. Oak and bamboo were the images that I came up with in studying end-of-life issues. And what came out were very clear differences based upon basic, fundamental cultural beliefs. And that determined positive coping strategies, which were very different. This is a chair, a bench in Italy. Think of our benches here, which are linear to give you your personal space. It's hard not to interact with whoever's sitting with you on this bench, even if you don't know them. You know, it forces interaction. This is another cultural way, the material culture way, of speaking to what is valued in that community. We have mixes, as again I mentioned. But the role of parents is critical, but the role of community that the parent is nested in is essential to give them support. To treat everyone equally, you must treat everyone uniquely. So for policy, how do you do that? You know, when it's for the general good. So how will your committee integrate the focus on different definitions of integrity of parenting as an outcome in a multicultural world and globalized world? Thank you.